Once again, it's on, people. You already know. I'm Lance Jasper Jones, and this is Jasper House Warriors. Today, we're going to be talking with clinical psychologist from the University of Pittsburgh, Dr. Charles Jonassaint, and we're going to be discussing the new nationwide program, CaRISMA, for sickle cell patients. Let's get into it. How's it going today, Dr. C, as I like to call you?
Hey man, I'm feeling bright. I'm feeling energetic, man. I'm looking forward to the new horizon that we got going on. It's been great connecting with you and connecting with Jasper House. Obviously, you're doing great work, and the synergy that we have between what you're trying to do in the community and what we're trying to do on the academic side, man. It's a beautiful thing because we know that although we think we have all the knowledge in the academic setting, we absolutely have to acknowledge that things only get done in the community by the people for the people. So I'm just absolutely floored by the things that you've been able to accomplish. Somebody living with sickle cell, all the adversity you've had to overcome, like you just said, got accepted into the honors program, right? It's fantastic, man. So yeah, man, I'm just happy to be here.
Thank you so much. Thank you for all of your great words, man. Thank you so much. So I'm going to get into you, talk a little bit about what you're doing and a little bit about your background, because also you are a very extraordinary person as well, working for people with sickle cell. So tell us how you got started.
Yeah, no, I'll tell you. Just I'm gonna go back even back into high school for you real quick, just because
Yeah.
um, just so you know where I came from. I actually grew up in Canada, in Vancouver, British Columbia, on the West Coast, and I had some black friends up there, but I didn't have a lot. I was mostly growing up with white people, but that did not stop me from thinking that I was the thug. Thinking that I was cool, trying to sell drugs, trying to get into the wrong things, right? Just trying to fit in actually, and realizing that the people that I was with, I just never really fit in. But even though I tried as much as I possibly could, and it got me into a lot of trouble. I played football. I always wanted to play football in the States, but my grades, they just weren't there. I almost failed out of high school, actually. I sat out a year after my 12th, my senior year of high school. I had to sit out a year because I had to do summer school. So I sat out a year of football. After I got summer school completed, I did community college. And because I registered late, of course, everything I did was late at that point, last minute, unplanned. Actually, my girlfriend's father, he was a psychologist teaching intro to psychology. He's the one who got me into psychology at the community college as a late registrant. And that was the first time things clicked for me. And my grades shot back up, because I was interested in the subject matter, and you know what it is. And after that year of community college, this school in Minot, North Dakota was still offering me a scholarship, even though I hadn't played for a year, collegiate football. Clearly my grades weren't great, but they still were offering me a scholarship. That's what I could afford. Went down to North Dakota for 4 years, did broadcasting, and I did psychology. So that combination, you can see it in some of our work now, as we're trying to hit social media just in the same way. But what it really did for me was it helped me recognize that, man, sometimes if God's got a plan for you, there's nothing we can do to screw that up, right? But
Absolutely.
it might be a bumpy road, though. I'll tell you that, because it was a bumpy road. There's a lot of depressing times. Um, but got myself together when I was in North Dakota and ended up going to Duke for graduate school for clinical psychology, clinical health psychology. And it's at that time at Duke when I was actually studying cardiovascular disease in older African American men that somebody pulled me aside. It was actually somebody that I still work with now, Laura DeCastro, at the University of Pittsburgh here. But she kind of grabbed me and said, "Hey, you might be interested in sickle cell." And like I was saying, when I was in Canada, I just never found a place where I could fit in. When I was in North Dakota, same thing. It's not as though that there's a lot of people that look like me when I was in North Dakota either. And I tried my best to fit in. I did the broadcasting, I did the psychology thing, and I did the football thing. And, those were my pastimes, but it wasn't really me. But I tell you what, when I worked with Dr. DeCastro and I was able to sit down with sickle cell warriors, you know, in their clinic and in their community-based organization there in Durham, North Carolina, it really did click. I was like, man, these are my people. Like, this is a people that I feel like I fit. You know what I mean? And you know how it is. It's all daps and hugs. It's not like, how you doing, sir? Right? You know, we can all walks of life. We're all close. We all have some type of connection. And it's just one of those things. And, you know, sickle cell, you don't choose sickle cell chooses you. And, you know, from that point on, and that was in 2004, and I've been studying and working with our sickle cell population ever since. And mainly have been doing work with adolescents and adults, mostly adults, but some work with adolescents. After Duke, went to Johns Hopkins and did 3 years at Johns Hopkins, working with their sickle cell group, and really got into, you know, how we can keep adults with sickle cell out of the hospital. And because, to be honest with you, man, because I was like, hey, you know what, I've never got the experience to go to an HBCU and just kind of understand what it's like to work with in a Black institution. I've been on these white institutions, but I'd never got a chance of like, hey, you know, what is it like to be around all Black people, to be with Black professors, to be with Black colleagues all the time. And I got the opportunity to work as a psychology professor at Howard University and work with their sickle cell group down there. And man, it was a beautiful thing. Like within a week, I was having coffee with other Black assistant professors. Right? It's just, when does it happen? When does it
Right.
happen? So it completely blew my mind. I love DC, but yeah, because of you know, my wife, I was a two-body problem. My wife, she's a physician, and she needed a position too. They didn't have anything in DC for her, but the University of Pittsburgh, they were growing their sickle cell program. Like I said, Laura DeCastro, she had moved from Duke up to University of Pittsburgh. Even my father, who is a sickle cell research nurse, he had also been recruited to the University of Pittsburgh, and my wife was being recruited to the University of Pittsburgh. And, you know, Greg Cotto, who's another, you know, prominent hematologist, and then of course Mark Gladwin, Enrico Novelli. You know, it's the mecca of sickle cell up here. You know, it was hard for me to say no. It was hard for me to say no. It's the stars aligned. You know, we wanted to be the center of the universe when it comes to improving the lives of individuals with sickle cell. And, you know, I feel like that's what we're doing right now. So I've been here at University of Pittsburgh as a faculty member for 8 years, pushing on 9. So, and it's only getting better.
Wow. I just want to give you, as a Black man, a round of applause. You know,
Oh, thank you, man.
um, and definitely for everything that you've been doing currently with sickle cell. We're going to get into that. Let's talk a little bit about CaRISMA. What's the purpose of the program? What's people with sickle cell? How can they sign up? You know, how did it come about? So talk to us a little bit about CaRISMA.
Yeah, charisma. Charisma is really about a program to deliver evidence-based behavioral pain management to a group of individuals who have not had access to that type of care before. All right. I'm a psychologist. I still see patients. I don't see as many as I used to, but there's a lot of need in our community, in our Black community overall. I mean, particularly among, you know, Black adults with sickle cell. Particularly, there's enough stress as it is just being Black in America. You add sickle cell on top of that, man.
Come on now.
I don't, I can't tell you enough. You know, and there's going to be pain there, both
Yeah.
psychological pain and physical pain, right? And what we're trying to do is just make sure that not everybody's going to be able to have time to drive over to the clinic, come up into the lobby, wait 30 minutes, then come and sit face to face with me for 45 minutes, and then get back in their car, drive home. And, you know, not everybody's going to have time to do that. It doesn't fit in with the way that our lives work. In addition, there's only a few, very few behavioral specialists or psychologists or people that are able to provide behavioral therapy available. And then even a smaller number that are really fit or culturally competent enough to deliver the appropriate therapy to people like you and I.
Correct.
That said, it doesn't mean that there's less need. Just because there's not enough supply and access doesn't mean there's less need. And what we're trying to do is to say, hey, we know a couple of things that work. Can we use your cell phone? Can we give you what you carry around every day and make this a tool for you to improve your care? And what CaRISMA does is it actually compares two things that we know are good for you. One, self-management and education. And we spoke to many warriors, and it was funny. We said, I brought 8 people, 8 adults with sickle cell into a room, and I said, hey, what's the top priority? If we could give you one thing to improve your care, what can we give you? Man, you know what they ranked number 1? They said knowledge. I was
Yes.
like, man, that's
Yes.
powerful. That's powerful. I was thinking, you could have said like money, could have said like more opioids. You could have said, give us more like respect. They were like, no. At the end of it, we kind of went through an exercise and everybody kind of ranked, well, is this one higher than this one? Is this one? And at the end of the day, the highest one was knowledge, because I think that everybody in that room, they realized that knowledge is power. And the powerful thing is that people like yourself with Jasper House, and our other community partners, Sickle Cell 101 in particular, but Sickle Cell Warriors, Sickle Cell Community Consortium, our community-based partners, they've been pushing out power, knowledge to the community for decade plus now. And they've been doing it much better than we're doing in academia, much better than we're doing it in these clinics. And what we wanted to do was say, wow, we see what you're doing. In particular, shout out to Cassandra Trimnell and Sickle Cell 101. We see what you're doing on Instagram. You are making education engaging and malleable, palatable. Sorry. So people actually want to have these tasty bits of food. It's not like Charles sitting here lecturing you on, do you know what your hemoglobin level is and your hematocrit is? All right. Let's do an electrophoresis and figure out your genotype, right? It's actually in a way that people can relate to it. And what we said is, hey, we know that education, psychoeducation, is effective for improving self-management, improving self-efficacy, and decreasing chronic pain. Can we deliver that and compare it to something else that we know works? Having cognitive behavioral therapy and having that delivered via a computer or a mobile device like this, we know that works as well. But we haven't ever been able to get it in a large enough group of adults with sickle cell to determine if it still works for sickle cell disease and which one works better. The second piece of this is, we knew that if I just grabbed some cognitive behavioral therapy program off the shelf, because we're comparing it to something that Cassandra and her group, they've been doing for the last almost 10 years, and they know what engages the community. We in academia, we don't know what engages the community. We are absolutely corny as all get out. I'll tell you what, the first few educational programs I tried to do, Jasper, I was like, they're like, my friends were like, nah, bro, that's not the thing. That is not the thing. And what our warriors said to me, they said, hey, Charles, I know you have a lot of knowledge, and I know you've been working in sickle cell for a while here. But if we're going to learn how to manage our chronic pain, we want to learn how to manage it from somebody who actually has this pain, actually somebody who has sickle cell. And that's exactly what we did. We got with warriors who were willing to get on camera and teach cognitive behavioral therapy on camera and make videos. We have some scripts that they edited for us, and we did this as a group setting. It was a co-development process. And it was beautiful, man. We made some absolutely super engaging videos, working with some fantastic warriors who are extremely dynamic on camera. And we came up with some great content. And we were able to put that in an app, and have both the Sickle Cell 101 education and the CBT in that app. So that's the core of CaRISMA. And the last thing is, of course, we know that with any educational program, with any strength training program, when you go to the gym, you got to have a coach. You can go and you lift weights, but you're just not lifting as hard. You're just going through the motions. You know how it is.
Right.
You get on that elliptical, you're like, you're more likely watching, Law and Order or, Judge Judy on the TV rather than really working out hard. But if you have a coach, you kind of push just a little bit harder. Maybe you do one more rep when you would not have previously. And that's what we have as a major piece of this CaRISMA project, to make sure that people are staying on track, staying engaged, and kind of pushing them towards their goals. And that coach will meet with individuals who are on the program once a week for 12 weeks or even longer if that's what you need. But we're trying to provide these tools because we realize that charisma is not something that you're born with. Yes, some people are naturally charismatic, but charisma is not something where you're born with. Charisma is something that you can build. And these skills that you get via this charisma program really are the skills that will make you more charismatic in your social life, in your personal life, just even in your thoughts, just even the way you think. We want you to think you gotta have Jasper level swag. You know what I mean? Like this is what we're trying to teach, right? And that's our hope, and that's why we call it charisma. To be absolutely honest, it stands for Cognitive Behavioral Real-Time Self-Management Program for adults living with sickle cell. But the truth is that yeah, we're like charisma, man. This fits because if you have that knowledge, you have that power. You have the ability to have more control over your thoughts and your emotions, you're going to be more charismatic, man. So yeah, so I'm super excited about it. We have 200 people enrolled right now who are part of the program, over 200. We're looking for another 200. And if you all are interested, please hit us up, CaRISMA, CaRISMA-SCD.com. Check it out. Check out the video. See if it's something that interests you. And even if it doesn't interest you, please send it to a friend.
Yes, sir. I mean, absolutely amazing. First off, as a person with sickle cell, we don't get a lot of resources coming our way, not even from physicians. When we go into the hospital, it's usually about stop the pain and then send them home. We're not doing a lot of,
That's right.
prep work, so charisma, to hear something like charisma and as big as it is, and partner with, Johns Hopkins University, Chicago, Illinois University, Duke University, and then also all the great advocacy brands that are out there, like you say, Sickle Cell 101. This is something that we've been looking for, someone to attach to us and help us, along this journey, because often we feel like we're on this journey by ourselves. We talk
Right.
to physicians and say, hey, what can I do so this doesn't happen again, or so I don't go into a crisis again? And I mean, true stories. I've had physicians tell me, "Oh, there's nothing more to learn about sickle cell," and you're just like, "That's not true." What? And yes, these are real stories. And so we have it hard just within the medical space, and so often, yes, it is about the knowledge that we want, which is, I think, is surprising to a lot of people to hear. It's not opioids, it's not any pharmaceutical style of treatment. It's just the understanding of what am I dealing with. And then from there, I can try to navigate it myself, because it is much of a lifestyle. Stress is one of the biggest issues, when it comes to sickle cell and going into a crisis, the weather, things like that. So having just the knowledge brings tools, and it brings also creativity of tools. And charisma is one of those creative tools that I think is going to make a big change in how sickle cell patients are living their lives. Definitely. And I am proud to say that I am also one of your newest health coaches, joining the team of many great, outstanding health coaches that were already on the team. So it's an honor for me to join you at University of Pittsburgh and CaRISMA program. So people, sign up, find the link. We're going to put it down below. Sign up if you're interested. You never know. You might get myself as your health coach. So it's a beautiful thing to be a part of. One more before we get you out of here. I know you're a busy man. Mental health. We're Jasper House Warriors. Our thing is tackling mental health. 18 years plus, clinical psychologist, working alongside people with sickle cell. What do you see as the mental health umbrella, the importance of the mental health umbrella within our space?
Yeah. Yeah, no, the first time I had a real encounter with mental health was my own experience. Honestly, I was in my final year, my senior year of college, and I realized I was missing classes. I wasn't leaving my dorm room, and I was sitting there in the dark, looking outside, and I was just waiting for Jesus to return because I didn't want to be here on this earth any longer. Um, and it was, and it was interesting because I was a psychology major at the time, and it took that thought to hit me several times before it clicked, and I was, man, you know what, I'm depressed. I'm like, clearly haven't left my room in like 5 days. I've missed all my classes. I'm not doing my homework. I'm out here, and it feels like that everything is overwhelming. And if you ask me, oh, did you feel down, sad, and blue? I probably would have said no, to be honest with you. I'd be like, no, I don't. I just don't feel like doing anything. I'm just flat. You know what I mean? Um, we find that 1 out of 4 adults with sickle cell that come into our clinic are going to have an experience that's very similar to that. Where maybe you're not feeling down and depressed, but you just don't feel like leaving your house. You don't feel like doing anything. Or maybe it's not that you want to isolate and you want to sit in the dark. Maybe it's just that everybody around you feel like gets on your nerves and you're snapping at everybody. And that's at least 1 out of 4, so 25%. But we only catch it maybe like 5% of the time. At most 7%. I saw in one study that they only identified depression or anxiety 2% of the time. That means that if you say there's 25 people that are out there that have sickle cell, or you say 100, let's do it, it's even easier. 100 people who have depression or anxiety, 100 people, and we're only catching about 20 of those individuals. There's another 80%. There's another 80% that are still walking around suffering in silence, and nobody's able to address it. And we, just like you had mentioned, we already know that there's consistent evidence that depression, anxiety, and just that stress and the sequelae that come along with this. And one thing, we probably won't have time, but we need to talk about PTSD, post-traumatic stress disorder. You were just talking about your experience of being on your honeymoon, having a acute pain crisis. How many times is that going to flat you? All of a sudden, you're in the hospital. I'm like,
ICU.
I see exactly ICU. You are right. This is the same experience if you are on a road. You're in Afghanistan, and you're in a Humvee, and there's a roadside bomb. It goes off. Boom. You didn't plan for that today. You expecting to have a very easy ride in the woods. Of course, it's Afghanistan, but you're expecting an easy ride, and then all of a sudden, your life almost flashes before your eyes, right? And that PTSD experience, that can cause a lot of long-term trauma, PTSD, post-traumatic stress disorder. And you might have many triggers for that same stress response that you associate with having a pain crisis and being in the ICU. And it might be something somebody says, right? Mm-hmm. They might just say honeymoon. You might just look at your honeymoon pictures or whatever it is, or it might be a birthday party, or it might be an exam. Like, oh, exams again. I remember the last time I was taking exams. Anyways, I digress. But we already know that these factors, depression, anxiety, stress, trauma, all these things, it's in your mind, yes, but they have a physical impact. They have an actual impact on your physical health, on your body. And if we don't address it, we're going to ignore. I would argue, I'd love to put a percentage on it, but I argue, that's 90% of it. And the reason I get that is not for myself. I'm speaking to warriors. Time and time again, they say, hey, Charles, If my mind's not right, my body's not right. And we know that the blood touches every aspect of your body, and just a little reaction of stress can change your blood flow and change that circulation and change how you're functioning. So I've been through a little bit of depression, anxiety myself, but I've much more experienced it through the lives of others. And I've never been through the experience of having sickle cell pain, but hearing from, people like yourself, I 100%, and the evidence that we have, I know that it is so critical. We cannot ignore this thing. We have to eliminate the stress and the mental health stuff that will get in the way of you living well with sickle cell and living your best life.
Exactly. So you touched on what is necessary here for mental health, the umbrella with people with sickle cell, but then also just our community alone. Like you said, 5% maybe we're catching 5% of people who might be dealing with, depressions and anxiety and things like that. For myself as a person with sickle cell, but then also as a psychologist coming in, my focus is medical PTSD, as I like to call it. And I often tell people, what does medical PTSD look like? I once sat for 17 sticks trying to get an IV in a row. 6 nurses, because they have to alternate, every other time they miss. 17 straight over a course of half an hour or so in the ER. So then what does that look like next time when you go, for any blood draws or anything like that? Right now I'm averaging about 3 to 5, sticks a time. So you kind of start building up something that you normally, are used to. Now you're like, okay, I don't want to go through this, and it's causing me even more mental stress just to have to sit in this chair. I have to go through this process, so it's that overall process of going into a crisis. Don't know if it's your last time, if you're going to make it out the hospital. When you go into the hospital, it's how people treat you in the hospital, but then it's also the procedure process of it all. And then imagine going through that 3 times a year for the rest of your life,
Mm.
for 17 years, 18 years, 33 years. You see, it's just become overwhelming, and mental health is a big part of how we handle that, and so you guys on the forefront of innovation really when it comes to treating sickle cell. Again, I am honored to be here with you, everybody. This was Dr. Charles Jonassaint, and we're talking about charisma. I am Lance Jasper Jones. This is Jasper House Warriors. We'll see you next time. Peace, y'all.